Happy Saturday, everyone, and welcome to the sixth day of National Public Health Week and the sixth day of me hosting these panels. I'm loving it. Definitely enjoying a lot of the conversations that are going on and just learning more about the topics. And today, I think, is a very timely topic, emergency preparedness. So just to give a little grounding before we get more into the conversation. Emergency preparedness and public health. Emergency preparedness ensures communities are safe before, during, and after emergency or natural disaster. Being ready for emergencies and crises is one of the best prevention methods available in public health. Preparedness helps to protect you and your community. This is especially important for underserved communities where disasters can worsen inequities and cause severe harm and even displacement. Unexpected events such as earthquakes, hurricanes, and other natural disasters can come at a moment's notice. With climate change, these events are occurring more frequently and becoming more devastating. Having an individual plan, an emergency supply kit, can be the difference between safety and injury. States also have an onus to test emergency alerts, educate their communities, and fund mitigation and equitable disaster recovery. In 2020, FEMA reported that 68% of those surveyed have taken three or more basic actions to prepare. For example, 81% have gathered supplies, 65% have sought preparedness information, and 48% have created emergency plans. Today, I'm joined by two experts who know a lot more about emergency preparedness than I do. And I'm very excited to introduce, well, I will let them introduce themselves actually, Krista and Ajay. And I would love for you all to introduce yourselves and let's tell us how you're showing up today on this wonderful Saturday.
Well, hello, everybody. My name is Krista Hyson. I'm the Director of Emergency Preparedness at a local health department in Ohio. How I'm coming today? I'm tired. It's been a long week. I'm sure it's been for you guys too. We've had a lot of severe weather. So in Ohio, we've had tornadoes, severe storms, and then we've got the solar eclipse, path of totality coming up on Monday. So we've got a lot going on, emergency preparedness and emergency management wise. So it's been a lot. I know you're dealing with some weather too as well.
Most definitely. And thank you, Amari and the Public Health Millennial, for having me this Saturday afternoon. Like Krista mentioned, it has been a long week, but I'm super, super excited to be here today and to be a part of National Public Health Week and specifically on this topic of emergency preparedness. Like Omari mentioned, I think this is a really timely topic. And with that, I would love to introduce myself. My name is Ajay Prasad. I currently serve as the infrastructure program manager at the Philadelphia Office of Emergency Management, where I have the pleasure of, developing strategic plans to ensure citywide response procedures, XYZ. Previously, I also had the pleasure of serving as a senior program associate with the National Network of Public Health Institutes, which is a national public health nonprofit. And there I was focused on preparing and training the public health workforce and the practitioners to address climate caused disasters as well as man-made ones, and really making sure that we're able to respond for the rest of the country and to also make sure that our workforce here in public health and emergency management is also taken care of. So super excited to be here today. I'm really glad that National Public Health Week is capturing emergency preparedness once again. And I think, yeah, we have a lot to chat about today. So thanks.
Yeah, well, thank you all for taking time on your Saturday evenings, afternoons to come chat with me. But as Ajay shared, this is like a very timely topic. And before we get into, I guess, the earthquake that happened in the New Jersey area, I wanted to get a sense of what does emergency preparedness mean to you all?
That's a big question, but I would have to say simply kind of anticipating for the what if and then planning for it. Because I like to say, when I was a kid, I loved doing theater and it was one of my favorite things to do. And now I grew up and I play pretend. It's not as attractive as or lucrative as Hollywood, but we play pretend every single day and we plan for those worst case scenarios. So really anticipating all those what ifs that could potentially happen, that is the basis of emergency preparedness to me.
Most definitely. And just to kind of add on to Krista's point, I think when we think about it from a public health standpoint, really, it's focusing on protecting health and well-being, both short-term and long-term, especially here in the United States, but also like around the world. Some countries do not have the opportunity to even think about just tackling chronic issues. So emergency preparedness, I think, is both a wide spectrum aspect. I also think when you're talking about it from a systems perspective, it's really looking at strategies to minimize, adapt, and prepare to large scale incidents, COVID, severe weather, flooding, and how those play out. So I think emergency preparedness, if depending on who you ask, you probably get a slightly different definition. But regardless, I think the essential parts of emergency preparedness to me are community, leveraging partnerships, and how we can utilize resources best to make sure that everyone has access to those in times of need.
Well, I appreciate you all sharing that and give us a good little overview of everything that we're talking about around emergency preparedness. And before I get into the next question, if you are tuning in, like feel free to drop any questions in chat. We'd be happy to, I'll be happy to ask those questions on your behalf to the panelists today, as well as hit that like button and share this with someone who gets some value from it or who is interested in learning more about emergency preparedness. So pivoting a little bit into the earthquake that happened in the Philadelphia, New Jersey region. I know prior to coming on the call, Ajay was sharing that that was something that happened in your day, in your life. So do you want to just talk more about that from your perspective as an emergency preparedness professional?
Yeah, most definitely, Amar. And I think, yeah, we really can't make this stuff up, right? I didn't think yesterday morning, my Friday, I thought, it should be kind of a relaxed day, hopefully, knock on wood. And next thing you know, the whole building is shaking. And we're like, yeah, I think we need to activate, dust off a couple of these plans. We didn't really, we have them, which is absolutely great. And I think that's exactly what public health emergency management is all about, is preparing for these obscure kind of situations. I mean, we thought a global pandemic was something that happened last century, and look at 4 years later. I know Krista has been absolutely through that. I don't know if she'll touch on that. But in terms of just kind of like from that aspect, I think what really stood out to me was thinking about in the cascading effects for such an incident like an earthquake, where yes, we are aware of them. You do have plans for it, but can you really prepare for that? What is going to be the fallout, both immediately and long term, in terms of making sure our people safe, and then thinking about structural damage, utility disruptions, are mass transit underneath the city safe, and all those kind of like nuanced, very very particular things across different sectors that in totality you really want to have a good scope with something like this. So, I'm really thankful that it could have, been much worse, just like, the Baltimore Bridge disaster as well, just kind of, all of those timings. But yeah, I think that kind of just shows me, you can plan, and you can have steps in play, but then the day you really don't know day to day what was really going to show up. So that's why it's really important to, have those kits, know your plan, know where you're going to meet your family and how you're going to communicate. So yeah, crazy world we live in, I think.
Absolutely. And Krista, do you want to add anything to that by chance?
Yeah, I would just say we have all these tools and things like THIRAs or your threat assessments, your HVAs, your hazard vulnerability analyses. And it's like no matter how much you plan, because we tell people, don't focus on planning for a hurricane if you live in Ohio or something. But who knows? I mean, I mean, have you ever experienced a earthquake before in your area? So it's like how often, because all the New Yorkers, I very much enjoyed all the tweets that were very comedic. But I think the biggest thing for people to realize is that this can happen and it could have been worse. So we need to make sure we adjust and make sure we're exercising our plans to make sure we can handle that worst case scenario.
I appreciate you adding to that. And I know that I have a few friends in that region who were really stressed out at that point in times. And many of them, I don't think they've ever been in an earthquake that was that big. And just like I was talking to my intern who's also in New Jersey, and she's like I can't remember what to do, and just like all these kinds of things. Because as you're saying, it's like these things happen when we don't plan, when we least plan for them, and then to the point that climate change is causing a lot more natural disasters that are becoming increasingly more devastating, lasting longer, and there is a greater need for emergency preparedness and for us in public health to really have that perspective and really like I think the perspective of an emergency preparedness professional is something that all public health professionals should try to like um utilize that philosophy of like let's prepare all the way that we can. Let's play out all the different scenarios that can happen, and let's ensure that we know what are the plans for those different scenarios, which I think is important. Before I move us into, because I want to kind of take us from like individual emergency preparedness into systems level emergency preparedness. Both of you all have had good careers in the emergency preparedness landscape. Let's say someone is in public health, they're transitioning into public health, and they were interested in getting involved in emergency preparedness work. What kind of advice would you give to them?
Yeah, Maury, I think that's really a great question. I think first and foremost, if you're just coming into your undergraduate program, I think really looking at your local agency, your local nonprofits, and seeing the work that's being conducted, whether it's severe weather related, whether it's public health preparedness related. There are what they're called MRCs, Medical Reserve Corps, that every state has. Some cities have them as well. That's a great opportunity for people to sign up. FEMA also runs volunteer opportunities in your local region. So that's a great opportunity, as well as there's trainings going on all the time, whether from your local emergency management or public health team. They're not also for professionals, and that's really, what I try to say too is a lot of time public health and emergency management, we're really in the space 24/7, being very situationally aware. So sometimes it's very hard for us to think about, the community and how are they showing up when it comes to emergencies and what are they doing for that. So I think that's just some like good starts is just really looking, just starting locally and kind of going from there, talking to people. Also, I think just the human aspect to emergency preparedness is sometimes forgotten. And I think especially people that work in emergency preparedness are really just looking to have this conversation and share this information. So platforms like these, I think, are integral as well.
Yeah, I was going to say platforms like you is perfect because you're exposing an entire group to they may never have had that interest, or maybe something sparked their interest and they're like, oh, I never thought. Because I started out in communications. I'm a public information officer by trade and transitioned more to an EP focus after, COVID chewed me up and spit me out. Like other PIOs, but it is one of the things where we want people to kind of know what they're going into for emergency preparedness. You have to have thick skin. So I encourage people to make sure they're volunteering in environments where they're uncomfortable. encourage people heavily to be okay with getting uncomfortable. Because let me tell you, showering in a trailer isn't glamorous. Or when you are walking into a home, take for example, walking to a home post Hurricane Harvey and the smell of just everything in a home post hurricane isn't great. And it's not glamorous and it doesn't, it breaks your heart, but I believe that if you're put in those situations and you kind of ignite something within you that you want to help, you have found the career path for you because you can't be afraid of it. So I encourage things like MRC is a great opportunity. Sometimes they also have CERT teams depending on your jurisdiction, but there's lots of ways to get involved. I mean, even if you're online and it's the FEMA ICS or Incident Command System 100 and 700. Those are two classes that are kind of like the baseline of education for emergency preparedness and incident response. So if that kind of you're like, oh, sometimes the government classes aren't too exciting, but if something in that might ignite some thought, that might be a good career path for you.
Love that. I think too often, like no matter where in public health you are, there's just a lack of information on how you can get involved, how you can engage in that type of work. And I'm grateful for both of you all for coming on Public Health Careers podcast and sharing your stories. I will link the episodes to that below for anyone that's interested in learning more. And feel free to reach out to either of Krista or Ajay because they have a wealth of information that I cannot extract within these hour time frames that I'm talking with them. But definitely put the onus on you all to reach out and really like make those connections, make those relationships, and see if it's a field for you. And I love the point of like pushing yourself into more uncomfortable situations because many times in an actual emergency, that is what the situation is going to be like. So get used to that kind of uncomfortability. And
Mario, if I may, too, I think one, I totally forgot when I was mentioning prior, but one great opportunity that has recently come up is Public Health Americore. Specifically, Americore itself is a 1 year long service based opportunity for anyone in the United States to, volunteer with for 1 year. But specifically, this past 2 years, they've stood up the Public Health Americore, which is a partnership between Americore and CDC. And in these opportunities, as it sounds, it's obviously focused on public health, but specifically, a lot of places I've seen around the country are looking to address climate related issues in local communities, address emergency preparedness needs, gaps, conduct assessments, do surveys, do field work for people that are interested in public health, don't have any idea about public health, emergency preparedness, really just want to have that opportunity and be able to do that on the ground work, as well as there's opportunities that are fully virtual. So that's just something I would be remiss if I didn't mention. Definitely for everyone listening, definitely check Public Health Americore out in your local area and also across the country. There's always opportunities. So definitely want to mention that. And I think that that's what it is. There's so many opportunities and resources, like you mentioned, Krista and Omari. It's just trying to find it all and list it somewhere. I think everyone, especially NPH and undergraduate public health students are so hungry to get experience and get there because I think that's essentially what's needed is to be able to understand what you're signing up for, understanding if you like this aspect of public health. It's so diverse, it's so big. You can really carve out a space for you. So I'm glad you asked this question. It's definitely super important.
Yeah, I'm glad you raised it up, and they just the point of like exposure being so important to this. I'm glad that the Public Health AmeriCorps has been like looking at that intersection, or communities are asking for support around those types of things because I think that's only going to be a need that continues to increase. So definitely, if you're interested in emergency preparedness, once again, reach out to these wonderful panelists here today. So you all alluded to maybe the answer of this, but I'm going to ask it anyway and just try to get more as an explicit answer from you all. So emergency preparedness is essential for safeguarding individuals and communities during unexpected events. How can individuals take proactive steps, such as building emergency supply kits and creating family emergency plans to ensure their readiness for different emergencies that occur?
I would say first, don't spend too much money because there's so many pre-made kits that a lot of people think they have to have. And a lot of the things are things in your home. They're just all over the place. So putting things in a central location like flashlights, batteries, Band-Aids, antiseptic, gauze, etc. Instead of, oh, there's something in the bathroom, something in the garage, something in the upstairs bedroom, however it may be. But I would encourage people, especially as an equity issue, a lot of times people are like, well, I don't have money to have extra supplies in my home. So we need to do a better job also as EP professionals of making resources more available, making sure, like I always make sure to look out for grants. If there's bags, go bag kits, I can always get grant funding for, and we can do different giveaways or things like that. I think also it is important to know what is in your region. So make sure you're preparing for the types of disasters that are most going to impact you. So not necessarily that earthquake. However, looking at what are those top three? Is it flash flooding? Is it where you would need water? And then also consider your individual medical situation. So are you someone that has any mobility issues? Are you someone that requires electricity to be alive? Are you someone on oxygen or need dialysis? So everyone's need is a little bit different. So those baseline items, I wouldn't worry about spending too much money on. I would concentrate on what are the things you can't live without. So if there's a certain type of medication that you need every single day, a lot of pharmacies will offer an emergency supply, and you just have to pre-call your insurance because a lot of time they won't authorize a refill within a certain amount of days. But if you ask for an emergency case refill for your emergency kit, a lot of times, as long as you call that insurance company beforehand, they will approve that.
I think, Krista, you absolutely knocked it out of the park in terms of everything major when it comes to people preparing. The only thing I could add to it is two things that come to mind. One is I think it's absolutely essential, like you mentioned, for everyone to have a kit and to make sure that's personalized for your needs. At the same time, making sure that you are aware of all of the community resources that are available to you in your local area, to your children, your loved ones, to your neighbors, whether it's fire and EMS, your local environmental hazard planning committee, all of the aspects that your public health department can offer, your emergency management agency, not necessarily knowing the day to day, but just being aware of who to call in a certain situation, where to find information, if that means signing up for your local emergency alert system. A lot of times in your local areas they have them, but they're all voluntary sign up. So you might be missing out on local alerts or kind of getting ahead of that information. So just again, being aware of those resources, evacuation routes, local shelters that are there. They're all already in place. You may not be aware of them. And I know, like, Krista mentioned, we do as public health and emergency management professionals need to do a better job of informing the public, making sure that how we share this information is also equitable, making sure that it's inclusive for everyone, every demographic that may come through your locality. So that's one aspect, just making sure again that you're aware of the services, and then two, when you're planning your kit or just when you and your family are reacting to an event, think about or try to think about cascading effects. So do you live in a place that is vulnerable to severe weather? Would you have to evacuate? So you have to take your kit. Where are you going to go? Do you know where your shelters are? Do you have loved ones that are in a safe place that's miles away. If you are on specific medications or you have medical equipment, do you have extras? Do you have, additional medications as well? But if you're leaving the local area as well, how do you get into contact with your medical provider, your mental health provider? Yeah, I can kind of go on and on in terms of that, but yeah, really just thinking about, okay, if I have to leave, what's next? If, we are in a food vulnerable area, like if I run out of water, where should I go next in terms of that? I know it may be scary to some people, it may be hard, and I totally get that, but when you're preparing, you want to kind of think a little bit long term and not just in the short term, even though it's so hard, it's so easy to sometimes. But great question.
Yeah, thank you for the information. And as you are coming in, if you'll have any questions or any emergency preparedness, feel free to drop them in the chat. Be sure to hit that like button and share this with someone who gets some value from the conversation. So digging a little bit deeper into like the role of public health professionals, emergency preparedness professionals on education and public awareness. How can we do a better job of sharing information and just ensuring that communities and individuals are engaged in preparedness initiatives? People have plans, people are thinking about cascading effects. What are the kinds of advice that you give to people out there?
I think one thing that always irks me, so imagine you go into a sporting event and sometimes you're really early because you want to get there on time, traffic, you want to see the first pitch or whatever your favorite sport is. When do they do the safety messaging? Like every single, whether it's basketball, baseball, whatever, if it's a local game, college game, or professional athletes, it's before. It's always before tip off or before the first pitch. And it covers evacuation routes, safety messaging, what to do if there's inclement weather, all those things. And I'm like, nobody's in their seat. Nobody's listening. So I think as as an agency, I know advertisers pay top dollar for that captive audience, but don't you think a shred of that is also should be reserved for the safety of their patrons? I mean, we've seen multiple even concerts that have safety messaging before, but how many concerts have we seen with catastrophic injury and or death recently? How many times have we seen, I mean, even what happened in all over the world with Taylor Swift's tour, they had someone die of a heat-related stroke during the concert. There's just so many things we can do better and make it during the time. There's so many ample opportunities, and I think it's up to both the players, not the players, the managers, owners of these amphitheaters and big arenas to say, hey, I'm going to 5 minutes and we're going to do 1 minute each. I know that's probably hundreds of thousands of dollars. However, I think you can't put a price on patrons and those people that keep filling your seats. And if you want them to come back, you need them to be safe. And I think that's an argument. We don't have a very large lobbying power. So public health, we have to advocate for ourselves constantly. And I know we're a broken record and we know we don't have money, but those are the things I think that could be those structural changes that are very tiny, but hey, when you have more butts and seats, you have more people absorbing that safety information.
I'm really glad you mentioned that aspect of public health and emergency management not having that voice. I know annually we always see, public health emergency preparedness grants and funding opportunities and bills in Congress, on the chopping block. And, every single year, multiple agencies around the country, large agencies, constituents, APHA, elsewhere that we, go and rally for Congress for this emergency preparedness funding. And I totally agree with the points that you made, Krista. I think it's also when it comes to awareness, I think it is a give and take, both from an agency, nonprofit, whatever is tackling emergency preparedness in your local space. At the same time, on the local citizens to have that desire to, want to be aware, to want to ask about, look at an example last year with the train derailment in Ohio and that chemical spill in the local community. And that local community was inquiring with the EPA for weeks on weeks, as well as that train company, on, are you sure that these assessments are accurate? Are you sure that you're aware of the potential long-term chronic impacts? And I think even now, certain families are still, dealing with that. So I think a lot of the legislation that came out in the 70s and 80s that, protect a lot of public health today, whether it's the Clean Water Act or the safe drinking water, etc., came out of emergency preparedness incidents, trying to prevent these incidents in the United States. So whether it's public health practitioners, whether it's the local community, I think using our collective voice to ask for more awareness. How can we work together? How does your local community like to receive information? Are there younger individuals that you tend to use social media, or are there folks that don't have reliable internet access? And we need to, think about that. We have regions across the United States that don't have that. So how do we reach out to those folks? So I think engaging with the community, understanding how they leverage, at the same time looking internally at our processes and continuously revising.
I appreciate you bringing that up. Not only the point that a lot of the federal policies that have come down came down in a response to protect populations, which I think is very, very important. And I think Crystal's point is something I haven't thought about a lot, but as she's saying it, it makes a lot of sense. It's like, why don't we have policies in place where a certain amount of time for marketing at the beginning is set aside just for emergency preparedness? Because as you say, like the risk to benefit to risk is like they're so huge. And yeah, so that has really got me thinking here. So I appreciate you raising that up because that was definitely not something that I've thought about. But many cases, as you're saying, like Taylor Swift concert, no Travis Scott concert, people have been getting injured, and many times it could have been avoided if there were messages there that were aimed at those types of populations. So that's an important point. And I guess this also comes from a little bit of what you were talking about already, but like how can governments and other organizations prioritize equity and inclusivity, particularly in communities disproportionately affected by disasters, in emergency preparedness and response efforts to address disparities in access to resource and support during crises?
I think you can't have the about us without us, simply. I mean, I can't stand when I walk into a room and we're going to talk about X solution. And I was like, well, no one dealing with that is here, or no one experiencing that, or no one with that actual lived experience. So you can only learn so much from the internet and a book, but I want to hear from humans that experience it every single day. I know that like one of the stadiums is redoing some of their ADA compliance because of issues at recent events. So making sure that they have a seat at the table, oh, cat appearance, apologies, are, able to have their voice heard, to not just be heard, but so it's actionable information, because nothing is worse than being like, look at the solution. And it's like, no, you didn't involve the community, you didn't involve the population. And that's something I think every industry is guilty of sometimes, when you try to do the right thing, but you did it with the wrong people at the table. So I think government should listen more and talk less. I think that individuals that have some of the most poignant things to say aren't often listened to because they are constantly burdened by certain things. So I think just giving that platform, I don't know what that looks like, but having that equitable way so that people could reach out, no matter the language, no matter the education level or whatever it may be, so that they have a way to communicate what those needs actually are. And that's when you're going to solve problems.
100%. And I think it also lends itself when it comes to public health agencies and emergency management agencies as a whole, thinking about breaking down those barriers with engaging in community organizations, nonprofit, faith-based spaces, other just organizations and groups of individuals that want to know about this information, but don't know where to start, have to go through XYZ channel just to find out this information, or, simply go on your local website and you find it out of date and or the resources link doesn't work. So I think um, we all know that in public health emergency management, we wish there was more hours in the day. We wish we had a clone of ourselves to, accomplish all of the work that we're really, proud and really wanting to accomplish. But as things come up, events happen, things like that. So I think really kind of having a bit of that foresight and trying to see, like Krista, you were saying, having those mechanisms, breaking down those barriers for organizations to at least reach out, like, hey, you might not receive a response in this week or in 2 weeks, but we have it in queue, we have it in a survey. Like, this is exactly what we want to capture it, and at least when we get a chance to, like, we can incorporate this feedback. It's not lost. And if especially if it is really critical, like I mentioned earlier, being aware of these resources and who you can reach out to for information. And then lastly, I just want to mention, I think, in the past several years, diversity, equity, inclusion has really come to the forefront of a lot of our work, even though we all know here in both of our spaces with public health emergency management, we really have been doing that work for a long time. But how can we, as practitioners in these spaces, hold ourselves accountable? We can say that our plans, that our strategies, that our operations have diversity, equity, inclusion principles based on, or these policies are based on this, but where is the equity impact assessment or the after action report that is looking in these vulnerable communities and making sure that they have the follow up? So that's really a call of charge, and really what I'm interested in, want to really apply is showing how we're capturing, showing how we're doing these actions, because then I think that's exactly how you build community rapport, is by showing how your policies that you're so diligently working on are translating into real world outcomes.
I appreciate you lifting that up as well. And I think this is a issue, or like something that we need just deeper in public health, is like, how do we get those feedback loops and that accountability and those spaces for people that are most impacted by issues to be a part of those solutions? And I think, like, to Ajay's point as well, is like, not only be part of the solutions, but then they are also in the conversations to see, okay, this was the plan, this is what happened, this is the impact. What did we do right? What did we do wrong? How can we do this better moving forward? And I think, like, that goes a long way in building trust and building just better partnerships and relationships where people are able to communicate around these types of topics, and really we will see better equitable outcomes when we do that kind of work. So that is awesome. And I'm glad that this is also a conversation that's happening in the emergency preparedness space, and hopefully we can get some good forward momentum on that as well. So pivoting us a little bit to educational institutions, play a vital role in promoting emergency preparedness among students. How can schools incorporate age-appropriate trainings and drills to equip students with necessary skills to navigate emergencies?
I think with the expansion of some of the exercises that FEMA has done, we've gotten things like games and workshops out of some of the exercise formatting, which can be very dry, very monotonous. But I think it in lies with just making it fun, making it entertaining. One of the projects we do with grade school kids is the zombie apocalypse. And we go through building a kit, or, kind of run, hide, fight against zombies. And while I wish we could set in place policies to protect our students a little bit further, I won't get into that. But having them be able to get into content that speaks in their voice. Like even shows like Paw Patrol or Super Kitties that are most recent. One of my best friends has a daughter that's very into both of those. And when she tells me about the episodes, I'm like, this is phenomenal. Like, look at the evacuation route or how this toy was saved. I was like, that is kind of teaching kids how to protect themselves, how to stand up for themselves, how to, question, if something doesn't feel right and what to do if it does, and what happens in an emergency and who to trust in an emergency. So I think we don't have to think so hard and ask kids what interests them and kind of, follow their lead, see where it goes with them. So that's what I would say.
100%. And I'm so glad, Amari, you mentioned this because, I've really spent the past year and a half in thinking about workforce development and how we can bring more people into both the public health and emergency management spaces respectively in a way that they're really interested. I think, as I think we all know here, COVID-19 really brought out a desire in people across the United States and across the world to do something greater than themselves, whether it's addressing the pandemic, whether it's addressing climate change or local environmental impacts in their area. So like the same type of energy, I think we can really capture it, starting in middle school, starting in high school, and really, I think, kind of the age old conundrum we're facing in both of these spaces is I just wish I'd known about it earlier. I wish I'd known the opportunities. I wish I'd known what's going on in these spaces. I think, a lot of people find out about public health emergency management tangentially. I took a class here, or my friend is an EMT here, is a nurse in here, and they tell me about this story, and I, Google this. So how can we get, capture these individuals, and at the same time how can we make education and training opportunities easier to access at these levels, at the middle school, at the high school level, give them more apprenticeship type opportunities. I think the world's our oyster, and especially with technology, leveraging AI to do exercises, like Krista mentioned, gamifying things. I think, yeah, we really, and then also teaching and educating people on the impacts of climate change. I think we can also really, inform people on localized impacts in their area. So I think so much can be done, but by forgetting about this, audience, by only, thinking about it during the incident, I think we really lose out on, a lot of good opportunity in terms of emergency preparedness.
So it sounds like there's a lot of work that still needs to be done. And I'm glad that you all are parts of this field and doing that work. Jay, earlier you shared about public health, emergency preparedness being like a systems level, or like you're interested in the systems level of emergency preparedness. And we've spoken about at the individual level, at the organizational level. Can you tell us more about what does systems level emergency preparedness look like?
Most definitely. I think that's a great question. And by absolutely no means am I an expert in this. So, this is kind of where I've seen, but just really thinking about, like I mentioned earlier, the cascading impacts, looking at, how individual offices, agencies, cities, localities are responding to an incident, how it affects them in that area. And then, somewhere nearby, I think a great example of this we saw in the past 2 weeks is, again, the Port of Baltimore bridge collapse. Even though that impacted the greater Baltimore area, the impacts were felt all over the Northeast coast. Now we have to think about shipping, moving, maritime and vehicle traffic. How does that impact economic impacts? What if that port was a important port for gas that is used at local hospitals, or different medical equipment coming into the United States. So addressing it and thinking about it in terms of not just your local area, but how all of the little individual kind of chess pieces, if you will, play into it, and really just breaking down those barriers, making sure there's multiple avenues of communication, making sure there's redundancy in things. I think in this space, in the space of emergency preparedness, and redundancy isn't actually a bad thing, and that we should lean into that. And then lastly, how can we really like learn? I know we always, say like lessons learned from this XYZ, but how can we very quickly take these lessons, repeat, rinse, repeat, to update this plan, update this policy, and get back into the field? Because at this point, I don't really see our work ever stopping. And that's what I think people like to kind of laugh in our space. Is like, yeah, like will have a bit of that job security, but unfortunately, but this is ever more important. Why I think more and more we need to have these conversations in these spaces.
I think our ultimate goal is to work ourselves out of a job. That's kind of what I tell myself every day. And I have a second job because I'm silly, as I'm also a public health advisor for HHS. And I am on a rapidly deploying team that responds to certain level of disasters if it exceeds the needs that the state could handle. So seeing it both at the federal level, but then also working at a local health department, I see those systemic issues every single day, from how PPE is moved to the ways we could have improved the SNS during the pandemic. I mean, the list goes on, but I think just having an awareness overall of the entire system is so, so important for both locals, state, federal, et cetera, and those nonprofits that support those agencies as well, just so nothing gets left behind, because there's so many things that can fall through the cracks, like you said. So, yes, a bridge went down. However, that's not just travel. That's not just ships. That's not just the movement and logistics of things. Like the biggest economy in Maryland, if I'm not mistaken, is catching like fish and selling them. And I was like, that was the first thing I thought, because my head goes back, because I think of all the systemic issues that are still from the BP oil spill and Katrina and all those things that still have ripple effects throughout the community, and just all the parts and pieces that sometimes get left behind are also those usually most burdened and disproportionately affected populations. And that can't continue to happen. And that's where we need to do better.
Yeah, I appreciate your insights into seeing that these issues are like not only happening on a local level, but they go all the way up to state and federal level, and there's just more that needs to be done to ensure that our emergency management and emergency preparedness systems are set up to ensure that communities are safe, and especially those most vulnerable communities are safe and getting access to information, support, and all the other things that they do need. And you did mention that you are working in the emergency preparedness space at a local health department. What does that look like?
So, I mean, the past couple weeks, it's been measles prep, because, we kind of pivot to, I call it, the soup du jour, like what's happening today? Is it severe weather? Is it measles? Is it a new COVID variant? So I've got a fantastic team that is divided into different sections. I have one person that focuses on regional work because of where I am in Ohio. We're very close to Northern Kentucky, Southeast Indiana. And so just because something happens on one side of the border, it absolutely impacts the other. So we play very well with our hospitals' resources, things that could potentially impact health. So I have one person that focuses regionally. I have one person that's dedicated in an ERC role, or emergency response coordination role, that really focuses on those local plans. And then I have someone focused on CRI, or the City Readiness Initiative, because we live in a larger area. So CRI is dedicated to preparing cities for all sorts of things. We also have a UASI grant, which is the Urban Area Security Initiatives. I'm trying not to use too much alphabet soup, but that is 80% of our jobs is alphabet soup, making sure that we have those items in place right now for a medical shelter. So if for some reason there needed to be a large evacuation, and there were injuries that would overflow our hospitals, we would set up a field hospital or a FEMA medical shelter, making sure we have those things ready to go at the health department level, because sometimes we need to act more quickly than the federal government can come in to respond. Sometimes that response, even that 12 hours, is too long. But a lot of times it's kind of seeing what's happening every day, but then every other day is checking those plans, updating those plans, making sure those after action reports actually reflect changes in the plans. And then the continuous QI is a lot of what I do, making sure that we have that quality improvement process into what we do. And that way we're better than we were yesterday.
That's awesome. That's awesome. And it's cool. It's kind of cool, different. I didn't expect you to say measles, but I think that goes to the point of like, what are the things that are coming up as emergencies in the community? And measles is one of those things, but that just highlights like how we have to be prepared for all the different scenarios that can happen to a population, and that can be an earthquake, that could be measles outbreak, that could be anything in between. So it really just shows like the deep breadth of this work, and I love the fact that like y'all are just looping back, like, okay, we've done this, it happened. How can we do this better? And then it's a continual feedback loop. And as we know, the earth is going to continue to do its thing. So there are going to be natural events that happen that cause issues. And as we've spoken about, climate change is going to create more of those, more devastating impacts of those. So I think like this process is very, very important. And we continue to need you all on these front lines doing this kind of work. So I appreciate you all, first of all. And to kind of wrap up the conversation with these last few questions here, I just wanted to ask, what are you all excited about in the emergency preparedness space?
That is a great thing. I don't know if more so in the emergency preparedness space, if not personally. Earth Day is coming up in April. That's always my favorite time of year. So I just want to, remind the audience, let everyone know, get out this month. Winter has been long. Life has been crazy lately, especially if you're working in the public health, emergency management, healthcare, any of those adjacent fields. It's been a long couple of years, and we're still chugging along. We're still doing absolutely wonderful, even if it feels like it isn't. So just a reminder to get outside, to really enjoy the greenery, the spring air, and just take day by day. I guess that's more of my positive message, and I something like I always try to make sure my colleagues and the people in my life, remember. So hopefully the rest of the emergency management folks out there think of that the same. I know, every day is a challenge, but yeah.
I think my motto is do the next right thing, whether that is reaching out to a partner or being very honest with yourself and redoing a plan. It is okay to toss it. And I don't really like well, that's the way it's been. That's the way it always is. And I'm like, mm-mm. I don't accept that really as an answer, because I think we can do better. And sometimes, like you mentioned, some of the federal policies, you're like, oh, well, they were in the 70s. Think of how many things have changed since then. And it's like, it's time that we kind of keep up with it. Because also, while I have excitement around AI, So as a communications person, if I had something like that to do drafts of press releases during the pandemic, holy moly, that would save me so much time. But as a cautious public health practitioner, I also am like, let's pause. Let's practice the pause before we act and make sure we have those guardrails, policies, however you want to look at it, in place before an organization starts using AI heavily. And then also being honest with the public. What are we doing to have disclaimers of use of AI and things like that? So while it's exciting and I see people, it's everywhere, it's in advertising, you hear it on podcasts, I don't think people really have a grasp of what it truly is and what it truly isn't and the full capability. Because I think do you remember the old Microsoft Office paperclip?
Yes.
It was like, hey,
Oh my Lord.
can I help you? Can I
That
help you
broke.
write a letter today? That's technically AI. It was a machine learning type thing where on a very, very basic level. But I just think of I don't think people understand the privacy issues and the complex issues. I'm thinking health information. I'm thinking people's privacies. I'm thinking your identities. I'm thinking identity theft is going to become a public health problem because everything kind of becomes a public health problem in the long run if it impacts your health and mental health. But all that to say is we try to do the next right thing, whatever that is.
That's a great motto to live with, and I think a great that takeaway insight that people can really take with them. And I completely forgot about that little clip. I think
I
his name was
believe,
Clippy.
I believe his name was
Clippy.
Clippy.
You're right. You're right. I was like, wow. Yes, I remember that. That's awesome. But yeah, AI is definitely there are a lot of use cases, but I think it's way too early for us to really understand the impact of it. And then as well as to your point of like, what does regulation look like around this? How do we like really ensure that this is equitable and provides like good information and it's not spewing out things that are inaccurate and things like that. So there's a lot of work to do, potentially a lot of potential to work with AI to work to really solve a lot of these issues. So I appreciate you bringing that up and like jogging my memory on that because I literally forgot about that. But to close us out, just wanted to change gears a little bit and just ask like if there are any favorites. So that could be something that you saw that's exciting, a movie, article, podcast, something random that kind of popped up for you in the last few weeks or so.
I read a book recently and I'm blanking on the author, sorry, but it's called The Day the World Came to Town. And I try to alternate like one fun book, one book kind of tangentially EP related. But it's about the story of everyone that landed in Canada because the flights were diverted to, I'm not saying it right, but Newfoundland, in Canada where everyone was kind of stuck on 9/11. And they ended up staying a couple days in a town of like 2,000 people, quadrupled in a matter of hours. And the way they fed, clothed, took care of people, that's the community we want to see. We don't want it to take that level of awfulness to happen to have that level of community. That's how we should be living. But it's a really, really touching book. And then the show Come From Away kind of follows it. So it's a really good Broadway if anybody hasn't seen it.
I watched a movie recently for all of those that enjoy kind of that doomsday type of world melting down-esque movies. I don't always watch it, even though working in this space, but kind of was an eye opener. Greenland, it's called, and pretty interesting concept. Basically, long story short, a comet is impacting the Earth and is basically like, similar to the one that took out the dinosaurs. So, I mean, yeah, like we can plan all that we want. And I guess if we stack all of our papers that we printed our plans out, maybe it'll stop in the comments. But all jokes aside, super interesting movie just to kind of give some perspective on, yeah, I mean, like really anything can happen. So definitely check it out for if you kind of like it. By no means was it, crazy Oscar worthy quality, but hey, check it out. It's a quick movie.
Awesome, awesome. Well, I appreciate you all sharing those favorites as well as hopping on today, sharing more about your expertise in emergency preparedness, emergency management, public health. It has been a very fun conversation, informative for myself. And I will be sure to link both of your episodes of the podcast below. So if anyone is watching this afterwards and is interested, click on those links and you get to see more of their stories. And I guess this is Saturday. It's one more day of National Public Health Week. So I will see you all tomorrow for the future of public health. But thank you once again, Ajay and Krista. It was a pleasure chatting with you all today.
Thank you,
Thanks so much.
Omari, for having us.
Happy Public Health Week.
Ooh, I missed just that part. I ended it right before.